Welcome back in. May is Mental Health Month, a time to raise awareness, reduce stigma, and encourage open conversations about mental health. Just like physical health, mental health plays a critical role in overall well-being. Recognizing when to seek support and understanding that help is available and make a meaningful difference for individuals and families. So, Dr. Siva Yechoor is a psychiatrist with the Toledo Clinic, and thanks for joining us today. This mental health has become more prevalent in our society and talking about it and addressing the problem in the wake of COVID. We all experienced something we had never seen in our lifetime, the isolation and being away from our comfort zone. And I don't know if we'll ever totally get out of it. I know for adults, we were able to handle it okay. Children, though, they didn't know any better. Suddenly, you're 3, 4, 5 years old and your whole world changes. You don't know what normal is supposed to be like.
Absolutely, you're so right. I think COVID changed, I think at least a couple of generations, I think, would be affected by it. The young adults that we're seeing right now, they've been through that. Isolation, especially social isolation, has been terrible for them. But I have great faith in our human adaptability and resilience, and I'm sure they'll make up.
What are some signs to look out for to know whether it's you or your child or an important relative that it's time to maybe talk to someone?
The first thing about it is you're right, like talking to someone. And the signs and symptoms, as we call them, I mean, like what you see is a person withdrawing from what they normally do. And somebody who's not smiling, not enjoying the activities that they normally do. And especially for children, it need not necessarily be sadness or anxiety. It could be irritability. And just avoiding any activity, just isolating themselves. These are some of the first few signs that we see.
It's funny, too, because sometimes you don't know whether it's a mental thing or there's something wrong physically with them to where it's causing their mood to swing south. And so they're just not as talkative as normal. They're not as physical. They just don't have any energy.
True. I mean, physical illnesses obviously would be something that you would see, but physical illnesses always have some of the signs and symptoms, like a fever or rashes. But mental illnesses are no different from physical illnesses as well. I mean, they're pretty much, the organ that is affected is the brain, and our brains are such adaptable and fantastic organs, but they do get stressed. It's almost like as if you have a bone. I mean, you get a stress fracture if the stress is too much. If you have a trauma, the bone breaks. The bone and the brain are not too far apart. They're just cells in the body.
If you have a child who you think has experienced mental health, what's the first step you should go to? Go to their regular doctor, or do you jump right to a mental health physician?
No, I would say the pediatrician, the doctor that the child sees on a regular basis should be the first contact. Number one, they're comfortable. They've seen this person.
Sure.
And the doctor knows the child. And I think that's an important aspect as well. And the pediatrician, like most pediatricians, are aware of mental health and behavior health. If they think that the child needs to be referred, they would do that.
Well, doctor, thank you so much for coming in and talking about that. It's an important thing. As time we get away from COVID, perhaps some of these younger kids behind academically, behind socially, behind mental health, right. Hopefully we can get our society turned around in time.
Yeah, thank you for having me, and it's such an important topic that we have to discuss. Thank you.
If you have any questions, call Toledo Clinic.